Swati Grub. I'm glad to see you again in 8 Minutes Good Health with Dr. Sant. Today we will talk about danger signs among middle age, which is saying that you are having a heart disease. To make it easier, I would like to divide ischemic heart disease into two sub-diseases. 1. Stable angina, and 2. Acute myocardial infarction, acute MI. How different between this two sub-disease. I will show you the picture and talk about it. Before we will talk about the two sub-diseases, let's take a look at the picture. The top picture is a normal coronary artery. There are 3 layers of the vascular walls. There is a hollow tunnel where the stream of blood runs through. These flattened, round red stuffs are red blood cells. They run in one direction following the arrow, since this is a coronary artery. So, symptoms of stable angina is in the middle picture is the blood vessels, where ischemic heart disease already occurred. The hallmark of this disease, also known as coronary artery stenosis, is the deposit of cholesterol in between the middle and the inner layer of the vessel wall become a prominent bump, here called plaque. When the disease progresses, this fatty plaque grows bigger. Eventually, it protrudes into the vessel lumen and narrows the lumen to the point that the flow of blood is limited. At certain level, the patients will experience angina pain during intense physical exertion or when exposed to intense emotions or stress. At such times, the heart rate and pumping action are increased, therefore the heart needs more oxygen. But the blood could not deliver enough oxygen in time because its flow is limited by the narrowed artery. The angina pain occurs. Typical symptom is tightness in or across the chest. Sometimes the pain radiates up to the jaw or along the arms. Once the patients rest for a while, usually in less than 20 minutes, the pain is subsided and disappeared. This chest pain on exertion, which is self-relieved within 20 minutes by resting, is called stable angina. Another one called symptoms of acute myocardial infarction, acute MI. In this type of disease, the situation is as shown in the lower picture. Somehow, the covering layer of the plaque burst out. This causes the blood to form a clot there and occlude lumen of the artery totally. Blood cannot flow to the heart muscle at all. The heart muscles then are deprived of blood supply for good. The angina pain occurs and persists beyond 20 minutes, regardless of exercise or resting. So 20 minutes is an important cut point for diagnosis. Acute MI is a real medical emergency. The main issues with ischemic heart pain are 1. Tight in the chest, which may be a crack or not crack. This doesn't matter, but feeling tight in the chest. 2. If it doesn't heal by itself within 20 minutes, there is a myocardial infarction, which is urgent. If rest and self-healing for no more than 20 minutes, then the pain is not urgent. Actually, you can analyze this by yourself, and you must be able to analyze this as well. Things to be done while having angina pain. There are a number of things that should be done together with chest pain. 1. Immediately stop exerting force. If running, stop running. If walking, stop walking. 2. Relax all muscles immediately. Take deep breath, hold it for a while, then release the breath through the mouth slowly, at the same time relaxing muscles all over the body. 3. Immediately relieve stressful emotions. If you are angry with someone, forgive him or her. If you made someone angry, apologize. Do not imagine bad scenario ahead. 4. Drink water very often. At times, acute myocardial infarction and acute stroke are triggered by dehydration. Drink water until you feel that your body has got enough water. 5. If 20 minutes have passed and the chest pain does not go away, you are having acute myocardial infarction. First, call ambulance. In Thailand, 1669. 6. While waiting for the ambulance or on the way to hospital if possible, the patients should chew and swallow 6 aspirin tablets, 325 mg each, immediately. Such deed can reduce mortality rate. If only small tablets of aspirin are available, use the total dose of 1,950 mg. For example, 24 tablets of aspirin, 81 mg. This is very important, as this can help to reduce mortality rate. If there is oxygen, get oxygen, but if it is not available, that's fine, because there is no evidence that shows that oxygen reduces the mortality rate. Another one, which is well known among common people, is the sublingual vasodilator. One mistake patients usually make in doing self-diagnosis of chest pain is that when the symptoms relieved temporarily, do not jump to diagnosis of stable angina too soon. If the subsided pain comes back within a few hours, or say within 24 hours, it should be held as one continuous pain, and the patients should go to the hospital immediately.